Hi, today we're going to learn how to pull IVIG. First thing you need to do is make sure you have all your supplies set up, ready to go. Have a clean environment and wash your hands, which I've done prior. So we need our IV pooling bag, which is right here. Make sure we have gloves. We have our IVIG. Today's going to be 2 bottles. Our Purell to wash our hands again. We have our alcohol wipes for the IVIG, and then we have our drape, which we put all our supplies on. So the first thing we want to do with all our supplies laid out, make sure our area, we have a clean environment, lay out our drape, and this is to make sure we have a clean working surface. So we open our IVIG cooling bag. We can just drop this on our surface. We want to Purell our hands before we put our gloves on, and rub this in really good. If there's anything soiled on your hands, nurses know they need to wash that. I've previously washed my hands prior to this. I'm going to put my gloves on before I start pooling the IVIG. So this is the cap that's going to go on after, but I'm going to get this ready. So that'll sit in its package. We have this is the pooling bag. We have 3 spikes. We don't always use the 3rd spike, but if we have 3 or more bottles of IVIG, then we would. So what I like to do is make a clamp, because once you attach one of the bottles, it'll go up the other end of the tubing. So we'll start with 1. I'll open the IVIG bottle, wipe the top of it with the alcohol wipe. Give that a wipe. Take the cap off the spike. I flip the bottle of the IG, spike the bottle, open the vent, and I let the IG go into the pooling bag. And you want to make sure you get all of the IG out of the bottle. Try not to waste any of the IG. And I'll show you how to do that at the end. So you pull the spike, don't pull the spike out, but you need to pull it back some and get all that IG out of there. Alright, that's good. So the IG bottle is empty now. The last is dripping into the bag. I'm going to clamp this one off, and then we'll go to our next one. Open the next IG bottle. We're going to wipe the cap. Take the protective cover off again. Spike the IG bottle. Open the filter, the clamp, and that should go. So we're just going to let that drain into the bag. And you want to see the air bubbles because that means it's draining. And we're getting towards the end. Just pull down just a little angle. You want to get all that IG out of there. Be very careful not to take the spike out. You don't want to contaminate. Alright, so the IG is all out. We're going to clamp. So we're all done. Spike in the bottles. We unscrew. Put the cap, screw this cap on. Clamp. You can clamp either before or after. Some nurses do before, some do after. So if you clamp before, it won't leak out, but if you have the bag, it's not going to leak out. And now you're ready to spike the bag with your tubing and your pump, whichever pump that may be, and whichever tubing. This is where you put your tubing for the pump. And you are just about ready to be started. And then you just pick up all the trash and properly dispose of it. And that's how you pull an IG.